participate for the whole meeting.
Okay, I'll just write a note to.
But thank you kindly for your offer.
No problem. Thank you. Since it is 12:30, I'd like to call to order the Board of Health meeting for the 11th of January. Do I have a second?
Yes.
Okay, those in favor? Aye. We have a quorum. I have in front of me the December meetings of last year. I'm looking for somebody to move those. We have a motion by Dr. Capetta to do so. I'll second it. We've lost Stephanie again, but I'll second it anyway. Oh, thank you. Hi, Stephanie. Stephanie seconds that. Any questions, concerns, amendments to the minutes?
No.
Okay, seeing none, looking for approval of the December 14th, 2022 minutes. Everybody's in favor. Thank you very much. Moving on, the situational update. Please.
Sure. Lindsay Bond, epidemiologist. So I'm going to briefly go over COVID and its new variant, XBB 1.5, RSV and flu, and I'll give a little bit of an update on opioid overdoses as well. So for COVID-19 in New Hampshire, we've had a total of 370,096 cases, with 165 new cases reported yesterday. As for patients in the hospital positive for COVID-19, I believe we had 163, and there are 67 being treated with antivirals in the hospital. As for cumulative deaths, we've had a total of 2,879 cases since the beginning of the pandemic. For Nashua statistics, we've had a total of 26,564 cases and 11 new cases reported yesterday. This has been mentioned several times now, but this is most likely an undercount as it is only reporting cases that were tested by the state lab. As far as cumulative deaths go, we've had a total of 181 deaths since the beginning of the pandemic. We currently have 26 people positive in the hospital with COVID-19 in Nashua, and 12 of those are being treated. You typically give the community level, which is dependent on the number of individuals being admitted to the hospital. It was actually not available on the CDC website. The page was down, so I won't be able to give that today. For the new variant, it's the new subvariant of Omicron. It's called XBB.1.5. This is the newest variant. It first touched down in the Northeast and is now spreading throughout the U.S. As of severity goes, we aren't totally sure how severe it is. We have seen an increase in the number of hospitalizations. So still waiting to hear more information on that. One thing to note about this new variant and several of the new Omicron variants is that it's not responsive to monoclonal antibody treatments, but it is responsive to Paxlovid treatment. Any questions as far as COVID goes? Okay, so for RSV and flu, we have seen a bit of a decrease in RSV, which is some good news because we were getting a little bit of a surge about a month ago. And for flu, we did see quite a bit of an increase before the holidays, what we saw in the schools as well. Right now, it is starting to decrease, and hopefully it continues to stay that way. Any questions on RSV and flu? And I did want to touch upon opioid overdoses. It is the end of the year, so we can have a better picture of how this past year has gone with overdoses in Nashua and in the state. So AMR is a great resource as far as recording the number of overdoses that occur within Nashua and how they're responded to by ambulances. So according to AMR's newest report, we've had a 15% decrease in the number of overdoses that were responded to by AMR, but there was a 37% increase in suspected overdose deaths. So this often does happen when we look at overdose data. So when you see start to see a shift in the number of overdoses being responded to. Sometimes you'll see an increase in deaths because no one's calling 911 or they're already deceased at the scene. So this does make sense based on the information provided by AMR that we did see a decrease in the number of overdose responses, but an increase in the number of deaths. As far as hospital ED visits related to overdoses, I have a chart on this page. It tracks the number of overdoses being reported by month in Nashua, so at Southern New Hampshire and St. Joe's. It's been relatively steady since January, but we did start to see a decrease over the past 3 to 4 months since September, which is some good news. And then lastly, I wanted to touch on overdose deaths that have been confirmed by the medical examiner's office. Unfortunately, this only covers the whole state. It does not get specific to Nashua. And as expected, fentanyl is pretty much the overall most common cause of death when it comes to overdoses. You also have some where there's methamphetamine being involved and cocaine. Methamphetamine has become a little bit of a concern as it has ramped up over the past several years with use. And that is all I have for overdoses. Any questions?
Stephanie, again, any questions?
No, I do not, thank you.
Thank you. Chuck? Thank you, Lindsay. Appreciate it. Next on the agenda would be the director's report.
Yes, good afternoon. Bobby Bagley, Director for the Division of Public Health and Community Services. And I will just read our vision and mission statement. Our mission is to promote, protect, and preserve the health and the well-being of our greater Nashua region through leadership and community collaboration. Our vision is to have an informed, safe, healthy, and resilient community where all people can thrive and prosper. And we subscribe to the following values of integrity, leadership, adaptability, and respect. As far as operational update, main thing is that our reaccreditation, as you've heard before, we've worked on that. We've gotten all of the standards and measures completed, and we finally received notification that the portal is open. And so the accreditation coordinator and I will be able to upload our documents for reaccreditation over the next several weeks. And we're hoping to get everything done by sometime in February, because they haven't given us the actual date of when it's actually due to be uploaded, but we do believe it'll be sometime in February. But we're excited that we have been very ready to move forward with that. As far as our ongoing disease control and surveillance, you've heard the situational update, and we do continue to participate in the state calls. We continue to participate in the incident response team meetings that we hold internally with ourselves, and we continue to disseminate our weekly newsletter with EPI updates to keep the community and our partners informed. As far as a financial update, we did receive an amendment to our Public Health Network Services contract. There was additional funding that the state had they wanted to roll over to include in our Public Health Emergency Preparedness budget to enhance those activities, as well as increase the amount of funding that was available in our Health Disparities Community Health Worker program. And so we have that information. We got the amended contract, sent that forward to go through our internal processes here, and we're hoping to get that on the Governors and Council's agenda by next month. We do have until the end of the month to get that ready for those guys. And then once that does go through, it'll be just for this fiscal year, so it'll give us 6 months to spend this additional funding. And then the plan with this is to operationalize some of the activities that the FEP program coordinator has for drills and trainings, and then under the health disparities, the community health worker grant will cover the cost of some of the community health workers that we've had on board that were paid for by funding from New Hampshire Charitable Foundation. That ends, and so this money is coming in timely to keep those folks on board for the rest of the year. Some highlights from our community services department summaries, and each of their full reports are on the S Drive and have been submitted to each of the Board of Health members. With the Behavioral Health Team, they continue to facilitate our Mayor's Opioid Task Force meetings. And we actually have a legislative breakfast that's scheduled for.
I'm sorry to interrupt, Bob. Could you put the microphone on the right? Because when you look away, the microphone, we hear nothing.
Okay.
Thank you.
Thank you. All righty. We do have the legislative breakfast that's scheduled for January 25th, and an invitation did go out, so hopefully you guys were able to receive that, and the link works.
I do, yes.
So we're looking forward to engaging with the legislative leaders at both the state level and the local level in forecasting our future and how we address behavioral health issues, mental health issues, having a conversation about trauma, but from the perspective of our workforce and how the impact of workforce capacity has on being able to deliver those services. The team has also been providing the resilience movies, the biology of stress and science of hope in the region, and this focuses on creating a trauma-informed community to continue to build resilience. From some of the earlier work that we've done, we realized that some of the root causes of decision-making around substance use disorder and behavioral health leads back to traumatic events that individuals may have experienced early on in their childhood. Our health promotion and communications on mental health continues, and so there are podcasts that are produced in collaboration with First Generation Media. Those are in 4 different languages. There are weekly cable television episodes that are produced with our National Community Television program, and they just completed a mental health first aid training that was scheduled on January 9th. This team also participated in Marnita's Table, which is a Kresge-funded event that we've completed, and we should have our final report for this completed by February. You heard the epidemiologist report already, and our epidemiologist continues to maintain our situational awareness, facilitates our community health assessment planning process, also is facilitating our performance management and quality improvement initiatives, and also participated in the Marnita's Table event, and we'll be working on the final report with that team. Our community health workers continue to do outreach in the community, support all of the services under the division as requested with our clinic, with our outreach, continue to support environmental health food services inspections when needed, and they've been the key individuals participating in the podcast productions and the cable television programming. They also participated in the Marnita's Table event. And Abhimana, one of our community health workers, has been invited to serve on the United Way Advisory Board, which is a great leadership opportunity for him. Our FEP coordinator has continued to maintain resilience around our response efforts and has our MACE in a steady state currently right now. We don't have to be in an active state because there are no active outbreaks or anything like that going on. And then you've already heard how things are pretty steady with COVID as well. We had to produce an after-action report for the holiday stroll, so he was able to get that completed. And he's participated in a virtual statewide response to winter weather activities, as you can see, on the 23rd and 25th, from the 23rd through the 25th, so he was actually working during the holiday season. Thank you, Mr. Pat Henry. Our public health network strategists continue to participate in the development of activities around the region, was active with our Marnita's Table listening sessions, and in preparation of that as well, is working with our National Soup Kitchen and Shelter on a food access survey and listening sessions for our refugees and our immigrant population. They have a student out of, I think she's from UMass? Is she from UMass Lowell? That's working on that project, and so between our epidemiologist and our public health network service strategist, they're providing some support to her on that project. And our public health network strategist, Jane, has also been selected as a project leader for our Leadership Academy for Public Health, which includes working with some of our partnering organizations as well, including the National Regional NRPC, National Regional Planning Commission. Some of our partners here at Community Development and Transportation, as well as we have Lamprey on board with that. So 3 other community partners with our public health department on that project. And they're going to be looking at transportation issues in the region. Our Public Health Equity Officer has completed the Diversity, Equity, and Inclusion Certificate Program at Cornell University, so we say congratulations to Ida for doing that. And she's been the lead facilitator on the Justice, Equity, and Diversity and Inclusion, the JEDI work group at the YMCA over at the Greater Nashua YMCA. And I believe that, almost done. Staffing update. So we are really excited. We've been able to get some positions filled at the division. Our community health department has filled our part-time public health nurse position, as well as our LPN MA licensed positions have been filled as well. And Kim will go into some details about those fillings. And in community services, we've been able to identify a program assistant that we're going to bring on board, and we're doing second interviews for a health promotion specialist position. And we've hired one community health worker who will be joining us at the division next week. Let's see. And then community, as far as work development plan, we have our students, and we have one of our medical students from UNE. So Nicole is here with us, third-year medical student, and she'll be with us for another couple of weeks. And then we have the spring semester students from UMass Lowell, some nursing students, and public health students that will be joining us soon. And then there's just a list of some of the board committees and commission meetings that I've attended during the month. And that's it. Any questions on that combined report?
Thank you, Bobby. Any questions? Seeing none.
It's Stephanie,
Stephanie, I'm sorry. Go ahead.
wherever I am. Bobby.
Yes.
Board of Southern New Hampshire Health, Chairman of the board?
Yes.
Wow, congratulations. That's quite a nod to your value to the local healthcare system and quite a feather in the cap.
Thank you. Thank you.
You good, Stephanie?
Yep.
Thank you. And again, our appreciation for the board in general. Community health. Okay. Oh, sorry.
Hi.
Hi.
Is my mic on? Yeah?
I
Can you
think
hear
so.
it? All right. Sure, they'll let me know. Good afternoon. Kim Bernard, Chief Public Health Nurse for the Division of Public Health and Community Services. I'm reporting out for the Community Health Department for December of 2022. The report does have our data from all our programs listed. Let me know if you have any questions on that at the end. And just a few highlights to kind of build on what Bobby had mentioned. For staffing, we are moving one of our community health workers into a licensed position, a licensed response support position is what it's called. And he is actually an MA, so he'll be able to work in that MA scope. So we're excited about that. He'll be beginning next week, so we'll have an open community health worker position that is being posted. Also, we have one of our nurses who was per diem, has come on part-time, and she will be heading up. She's actually has experience from the state under the lead program, and she'll be our lead coordinator moving forward. And we still have our full-time RN position open, but we're working with HR to expand some advertising throughout the state and different media outlets. So hopefully we'll be able to fill that position soon. And just some other things to add is that our staff has been active with workforce development as well as attending different events with partners, such as the New Hampshire Behavioral Health Summit, which was in December. Multiple staff attended the Greater Nashua Public Health Advisory Council biannual meeting. We had some staff nurses attend the Greater Nashua Chamber of Commerce event, and they were able to network with community partners, which was great. And we also, as far as students go, Bobby had mentioned students, and we will be precepting a student nurse in her final year at St. Anselm's. We'll be doing her capstone portion, and she will be with one of our nurses. as well as nursing students from Riviera University and Nashua Community College. The rest of the staff have completed their reports within the Board of Health report. So if you have any questions on any of that, please feel free to ask.
Thank you, Kim. Any
Thank you.
questions?
Thank you. Thank you.
You're
You're
good,
welcome.
Stephanie?
So could you please just comment on the SANA data? It may be just due to the fact that it's just the month of December reporting, but it looks like there were a vast difference in the distribution versus return of syringes last year versus this year, and I don't know if that's, again, just a statistical variation from it being from 1 month, or if there's something going on.
Could you just add, I couldn't hear part of that question, Stephanie.
So the syringes
Mhm.
that are being given out, the
Yes.
difference between December of 21 and December of 22 is noticeable. And just trying to understand if that's a trend or something we should be noted, concerned about.
I'll have to check on the data and get back to you, Stephanie, because I'm not sure off the top of my head. I'll have to go back and look at it.
So if I can
Fair
add-
enough, and it
if I
may
can
just
add-
be,
What's
I'm
that?
sorry.
If I can add.
Oh, sure. Bobby would like to add something.
So one thing that we've changed, Stephanie, is that now individuals have to bring back syringes, and then they're given syringes when they return some. So that's going to be a big difference in what we were doing last year. So that may be why you see a change in the numbers. Yeah.
That would be a reasonable explanation, and it makes sense. Thank you.
Any other questions? Thanks, Kim.
Sure.
Thank you. Good job.
Okay, moving on, environmental health. Heidi?
Good afternoon. Heidi P. Kokoka, Nashua's Health Officer, reporting on the activities by the Department of Environmental Health for December 2020, within the fiscal year 23. Food service is our biggest program, has the most data points and information. We're now starting to list our voluntary closures as well. And we were considering putting our tickets on there as well, so that the board could be aware of the number of tickets given during inspections. The failure rate continues to climb. I think that we'll see it move around a little bit for a while. Things are still pretty unpredictable in food service and most businesses due to staffing and the price of goods and the availability of other goods as well. We continue to try and use a soft approach where appropriate and educate people to the best of our ability. We do see a phenomenon with a lot of change of ownerships, and we do see some, well, I was shocked to see that Bertucci's in Nashua is the only remaining one in the state. So these businesses are very highly impacted by what's going on. And we try to help and assist them to the best of our ability, but they still remain open, they're still serving food to the public, so we need to remain vigilant about making sure that that is safe for the public. Let's see. Don't see anything jumping out specifically as far as our institutional inspections or any of our routine activities, other than you may have seen the newspaper article about the dog that attacked its owner and a couple of people in the veterinary setting on DW Highway. That was awful. The people impacted were really traumatized greatly by that. And we just recently had another dog bite where the dog was euthanized because the owner couldn't control it. And it's tragic. It's not to say that there's a huge trend this way, but it is something that we are involved with and participate as far as making sure that if the dog has bitten someone and the owner has not opted to euthanize it, then we make sure that the dog has been seen by a physician, a veterinarian, and is up to date on its rabies vaccination. So most of our activities are around rabies and the control of rabies. We have seen our revenue jump quite a bit. We didn't expect that it would have increased as much as it did, but I think that the change of ownerships that I mentioned before may have something to do with that. But we're still just trying to see what kind of a baseline is going to be. And I mentioned last month, but here it is officially, that Ren received his CPFS credential. That's his Certified Professional in Food Safety. And we are diligent about trying to keep up the credits for the credentials. And so April attended a webinar on pest management. And these are different things that we've helped out other jurisdictions. We also created a bed bug action plan for the division for if we have any person coming in from the public or even the staff member who is experiencing bed bugs on their person or in their homes, we can advise and help. And the other thing, it is also the season to start watching the LSRs. And we're tracking, I think there were 822. We're looking at, I think, about 39 right now, and then we'll eliminate and we'll figure out which ones we're most concerned with. But there are certainly some trends as far as marijuana legalization. We're mostly concerned about the edible products and the edible products not being sold as food products. And so it's a lot of varied subjects that we're looking at. And that's about it.
Thank you, Heidi. Any questions?
This is Stephanie.
Stephanie, I'm going to have Alderman Timmons go first.
Oh, yes, please.
Okay, thank you. I just have one question. I'm not familiar with the acronym, LSR.
The what? Oh, legislative service requests. They're the placeholder before the development of a Senate bill or a House bill are put together. So that's what we watch, just to see what the topic might be, to see if we're concerned. Because once they start getting into the thick of things, it moves very quickly and language can change on a regular basis. So we kind of, at the beginning of each year, we take a look and make sure that we're not going to be missing something that's critical to the department. You're welcome.
Stephanie, please.
Thank you so much. Heidi, states that have legalized cannabis for multiple purposes have seen an uptick in children's overdoses, inadvertent due to the colorful appearance and candy-like appearance of some of the edibles. Do we have any shelf-ready education for the public? Because even if these LSRs don't go through, people bring products in from other states. Thank you.
We can certainly look into developing something. It's been something that we've talked to our FDA partner quite a bit about, because we do find some things that should not be sold in public from time to time. It doesn't happen very often, but so we are trying to remain vigilant about it, and yeah, would certainly be happy to develop some education around it as well.
I just think people don't have an awareness of how dangerous cannabis can be for our youngest members of the community. And it would be great. I'm sure there are things that are developed that we could adopt or adapt, but thank you for looking into that.
Thank you.
The older person brought up a point that I had written down also in my review. A lot of times in our professions, we use acronyms and we're used to using them.
Yes.
And it's not right, it's not wrong to think, but for some people who are not always knowing what those are, or it may be something new, or in my case, forgetful, I would think that maybe developing a glossary that we could have. I would also commend Bob. I was going to wait till after his, but if you notice in his, he writes it out every time what the acronym is. And I think at the beginning, this is labor intensive, but I think afterwards, you wouldn't have to write those out. That would be our responsibility with the glossary. If we can't remember, we can look it up, and that would save time for everybody. So I just put that out as a point of discussion, and certainly if the other board members feel I'm off base on that, feel free to shoot me down.
Sure. No, I think it's a reasonable, we all get in our own lingo, and we think everyone else understands our own lingo, and we have to be mindful of the audience. Both
Absolutely.
internally and externally, who might even be listening to us.
Stephanie? Are you okay with that?
Definitely.
Okay. And as long as, as long as the work and file members don't come and assassinate me for doing it, let's start trying to develop that.
Absolutely.
And then what we can always do is you can just mail out that glossary to us, and we can always print it, and it's a live document because it'll be
Sure.
constantly updated.
I will give credit where credit's due. Our emergency preparedness staff have been very vigilant on that, and I myself have complained as well. So thank you for pointing that out, because I have right here, I hadn't included in my report, and I just wrote out LSR, and my brain just goes directly to it. So I think it's a valuable message for all of us.
If it helps us, I think that's good. All right, so I'll let the staff determine when you would like to unveil that. I'm not expecting it to happen next month, but certainly if every department throws in theirs, and you can, I guess the best way of doing it is probably do it by department
Sure.
instead of alphabetically, and that way you can add to your department or subtract, et cetera. All right, not to get too far off the beaten track, Bob, would you like to present welfare, please?
Sure.
Thank you.
Bob Mack, Welfare Officer for the City of Nashua, reporting on welfare information for December. You can see a slight increase, I would say, in the shelter costs compared to last year at this time. That is primarily attributed to the fact that rents have increased about 18% in our community. So more people are needing more assistance to make those payments. As you look at the numbers of cases and such on the second page, and down in the narrative, we generally talk about the homeless households that we assisted. You can see 5 families and 1 individual that were assisted in emergency motel placements. Well, basically that means the other 52 households we assisted, it's primarily around homeless prevention. So whether that's directly through these rental or shelter payments or some other assistance such as utilities or even food and household goods, which is usually a much smaller amount. But these days, every little bit helps those households to meet those basic needs and maintain housing. We've always taken the approach it's more cost effective to keep people housed than to try to rehouse them, since it can cost, $600 some odd a week to house someone in a motel placement. So that has been our focus. Just wanted to highlight that point. We continue to work with our community partners to refer homeless households to shelter programs when they're available. The ones we assist in motels, it's generally because there aren't shelters that can accommodate them. I believe, mentioned at the last month's meeting, Director Bagley brought up the Healthcare Services Coordination Committee that is coming out of the CO, Greater Nashua Continuum of Care, to avoid another acronym. That's been an important meeting, I think, in identifying folks that need more assistance than they can typically get in a shelter placement and even in a motel placement. They need additional assistance coordinated to maintain that temporary placement, however temporary or long-term it may be. Some of the other meetings that we participated in were the Homeless Outreach Committee, also participated in the Regional Transportation Coordination Council, the Governor's Council on Housing Stability, the Homeless Encampment Response, which has been also pretty active, and that brings together both city departments, public health, DPW, police, fire, along with homeless outreach, Greater Nashua Mental Health Center, and those types, and shelter services. Backing up a little bit, the Nashua Soup Kitchen and Shelter did open up a low barrier winter overflow shelter program for the winter months with some state funding. Michael Reinke, the director, had informed me that they're seeing about 20 individuals per night staying in that facility. And we have been anxiously awaiting their transition to their new facility on Spring Street. It's happening. I think it's happening this week, but it seems every week I get it's going to happen this week. But they're pretty much on target at this point to make that transition for the singles that they're housing at one of their at the overflow shelter, as well as their main shelter programs. So that should happen. And the Hope Center, which is the single female shelter that was the expansion of the rescue mission, has been operational as well. And they've been serving folks, which has been beneficial to those that have stayed outside in the warmer weather, but they have alternatives now. We will also be participating in the point-in-time count that's actually happening at the end of this month, but we were involved, welfare staff were involved in the planning of that, that activity that will take place. We're continuing to monitor the Southern New Hampshire Services Emergency Rental Assistance Program. The funding has been extended. It's primarily addressing people in motels at this point. A lot of the people that had applied for emergency rental assistance in their apartments, they've exhausted those. That program is kind of winding down, and the focus is on those that are in motel placements. And to keep those households housed, they're focusing on single individuals, keeping them housed through April, or excuse me, I think up to April 1st, and then up to June 1st for families. So a number of partners across the state have been communicating with Southern New Hampshire Services and New Hampshire Housing Finance Authority, just to monitor the progress and to be planful of when that program ends. The Welfare Administrators Association has been actively involved as well, because we're expecting to see a bit of an influx in applications once that program does come to an end. So as proactive as we can be, we've had communication with Southern New Hampshire Services around households that are currently in the program, so that we can get an idea of what we might expect. There were some 30 some odd households that were in motel placements in that program currently. Let's see. We've expended about 49% of our budget as of the end of December, so typically we're not at that point in December. Historically, over the last few years, we've been less, but as has been discussed previously, when a lot of the households were getting that emergency rental assistance, they weren't needing to come to see us, so now we're starting to see a slight uptick in those requests. But we will monitor that closely, and has been mentioned, as it has been mentioned before, we have our Welfare Expendable Trust if we need to tap into that, but hopefully we'll be okay. We have also been monitoring some of the proposed legislation in its current form. You know, those, as Heidi mentioned, those sometimes they change as the language changes, so we're not exactly sure what they're going to read when they hit the floor. But primarily looking at things around tenant notifications of evictions and sales of properties where they may be evicted, and also incentives around development of affordable housing. I think some of the development of the affordable housing may be more impactful towards some of the neighboring communities. The city of Nashua has a number of different projects under development currently for apartments and such, so we'll see how those things play out. And one other thing to note, we did have a welfare specialist who had resigned, and we were able to interview and hire someone for that position, so they should be starting at the end of this month. And I think that's it. If there are any questions?
Thank you, Bob. Any questions, Stephanie?
All set, thank you.
Thank you, Chuck.
Thank you. Good job.
We're
I have
good?
a
Oh,
question.
I'm sorry.
I'm sorry, I have a
It's
question
okay.
and a comment, okay? One, I was looking at your utilities. I'm surprised to see it went down, considering the utilities appear to go up. What is the reason
Yes.
for that?
That's a very good question, and we still work with some of our mainstream partners. Southern New Hampshire Services in particular has the fuel assistance program. The other thing that we experience during this time of year is we move into a moratorium on disconnects. So unless it's an extreme case, a customer is not likely to get disconnected from service. Many times when clients come in to apply for the utility assistance, we're able to just work out a payment arrangement with the utility company. We'll work that out with the client, with the utility company, and in some cases, we don't have to pay anything. It can just be worked out in that fashion. So that's primarily why it's gone down. So we continue to refer to that fuel assistance program through Southern New Hampshire Services.
Okay, and I do have a comment, and this is a visual one. You guys are doing a fantastic job with the homelessness in Nashua. I've been to other cities, one named Manchester, and I'm up there a lot, and I cannot go past the street without seeing a lot of homelessness there. And Nashua does not seem to appear to have that problem, though we do have that problem, but you're taking care of it. And whatever we need to do to help us continue on that path, whatever you guys are doing, you're doing a fantastic job, because we just not having the tents and all that other stuff. And the car program, continuous care, all of that is working. Soup Kitchen and United Way and the health department working in conjunction with each other is fantastic. And that's my comment on that. Thank you.
Thank you.
Thank you for that comment, and I would just add, you know, it's a team effort within the community, public health, community health workers outreaching, the outreach workers from the different agencies, the shelter programs, some of the expansions of some of those programs have been key to with this effort, but it's a constant effort
Yes.
that we need
But you can
to keep
see
on
that.
top of.
You drive into a city, or you're walking around the city, and you see one city is this way and another city. It's just totally different. It's amazing. I just can't get over how clean up the homelessness Nashua is compared to a larger city. That's not interesting, I have to say. But whatever you guys doing here in Nashua is working.
Thank you. Seeing no
Thank you.
further questions, I'd like to move on, but before going over to public comment, Stephanie, you had a question that you wanted to
Yes,
present?
thank you.
Okay.
Thank you very much. So I don't think anyone will disagree that we as a society were caught off guard by the COVID-19 pandemic, and much work has been done around the pandemic and even anticipating additional pandemics. Hopefully, we will not be subject to that, but to be ready is important. One of the things I don't recall us talking about is when an individual facility experiences an outbreak of a communicable disease. And one of the communicable diseases that I have not heard happening in communal living settings is norovirus. Norovirus is usually associated with a hotel or a cruise ship. However, I sit in this hospital because an elderly person in the family contracted this virus at the facility. And I don't think that facilities in general have the understanding and knowledge of infection prevention plans to put in place in such instances, especially when the people in those communal settings are vulnerable. I was just wondering if you could enlighten me as to whether this has been addressed. Is this something that, as a public health department, we should be thinking about? And I thank you for your attention.
I can answer that.
Go ahead, Kim.
So Stephanie, yes, we do education. Are you speaking of long-term care facilities? So we do education.
Not just long-term care, but assisted living and,
I'm grouping
group
them,
homes
yeah.
for the disabled, yeah.
Yeah, so yes, we do education with those facilities. And we do it on a wide variety of diseases as well as prevention.
That's great to hear. Thank you very much.
You're welcome.
Thank you, Stephanie. I think this kind of comes under old business. I just was reviewing the announcement things, and in our minutes of December, we have a heading Other Business. I'll just kind of read it in case people don't have it, but I want to make sure it's tied up at a bow, and that's last year. But a Board of Health member mentioned that a constituent had asked if the Board of Health had taken up the issue of potential health risks of having an asphalt plant on Temple Street, which is a residential area. Deputy Health Officer to present the work he has done on the project. He wasn't there. We had tabled it to this meeting. So I'm not sure if anybody followed through on that, or anybody has an answer to that.
Oh,
We can, if we don't, we can certainly say in our minutes today that we'll do that next month. If somebody did do it, I want to make sure that it's done.
so, all
Where-
right, so
Where-
Bobby Bagley, Director. So what we did discuss, probably it was after the meeting, was the information that was provided allowed for us to see what the plan was for the asphalt plant. And, after that meeting, we discussed that there was no further discussion that was needed by public health because of the, yeah.
I don't think I was there, so.
Yeah, you and I. Yeah, so we decided that we were going to table that indefinitely.
Indefinitely, okay, that's fine. Thank you, appreciate it. The last thing that I have is, I got word from the high school, they were really excited about the van last year and like to do it again. I have the contact information, which I'll send to you, Bobby. The person who was the contact person retired.
You can send that to me. You can send
Last
that to
name?
me. We can send it to
Noe?
you.
And,
No, I was just saying you can send that to me.
Oh, I'm
'cause
sorry.
I'm the one
sorry.
that.
Yeah, that's not a problem. I have her email address and her phone, either way, whichever way you want to contact with.
Sure.
And I told her you guys are really, really busy in the spring, so hopefully you'll be able to do a date, but it had a significant impact on the students, so that was a plus. Most of them didn't even know we had a van, so it's good. people.
Tony?
Yes, ma'am. Stephanie, go ahead.
I'm sorry, I didn't mean to interrupt, it's a little bit of a delay. So can we just go back to the environmental impact issue for one moment?
Okay.
So there's two different things. One is whether or not an entity established or seeking to establish meets established criteria for the health and safety of the community. However, an entity can meet those standards and yet it can put people with vulnerabilities, asthma, COPD, and so forth, at risk. And I'm just wondering if we have any prepared statements or education for people who feel vulnerable as to what they can do if they have concerns to protect themselves. I'm aware that some people had raised some questions about, some of the large warehousing facilities being set up in communities for the likes of Amazon or such, where there would be a lot of, presumably carbon monoxide due to a lot of vehicular traffic. So again, my question pertains to education for those that are vulnerable. Thank you.
Could I ask Stephanie, are you looking for like a specific industry or a generic? Any?
I would think something generic,
Okay.
because I, as a pulmonologist, I'm not aware of any recommendations specifically for this inhaled pollutant versus that one. It's more about reducing exposure to particulate matter, things like, watching the air quality index and wearing masks, not for infectious reasons, but to filter out particulate matter and such. So more generic.
Okay, I just wanted to clarify that. Would you like to handle that question?
Thank you, Stephanie. Yes, we can, and can work on some messaging around protective measures around particulates and asthma with our health promotion, with our, right now, with our public health associate who is filling in for our health promotion communication specialist, and we can work with environmental health on putting some messaging out in the community.
Stephanie, if I could ask, since this
Yes.
is in your wheelhouse, would you like
Yes.
to assist them or be a
Oh, with
resource?
pleasure.
Okay.
Absolutely.
Okay.
And then the other thing is, there are states like New York and, Los Angeles that are already dealt with this for many years, and they may have some materials that we can adopt or adapt.
Sure. Looking at this from the other side, I would think that would be guidance for the aldermen, alder people, I'm sorry, to use as a reference when dealing with the generic, whatever,
Sure.
impact on the citizens of the city. Okay. All right.
May
Yes.
I add
Go ahead,
something?
Heidi.
We have in the past looked very closely at the air quality index and tried to disseminate that to the public and to try to explain what that meant for different people, different vulnerable people as well. And certainly an expansion of that would be wonderful.
Sounds like Heidi wants to be on the committee.
Happy to.
I would welcome the opportunity to work with Heidi.
Okay. Anyway, yes.
No.
Okay, sorry, I thought I saw a hand. Is that okay? Everybody comfortable? Okay, thank you. Now I'd like to close this part of the meeting and open up for public comments. Would our student like to make a comment? Well, you didn't think we were going to let you get through this without some kind of stress, right? You are in medical school, come on. Okay, seeing no public comments, I'm looking for a motion to adjourn.
One question before that.
Yes, ma'am.
Motion to
Sorry.
adjourn. I'm sorry. I want to bring up the Mohawk Cannery
Sure.
site, and I want to know how involved the public health is with that process.
Okay.
Because that's a big thing right now.
Okay. I don't know much or anything of it, so I'm going to have.
Redevelopment of that particular site.
Okay.
I think Heidi, I just saw it on the agenda, I think it was yesterday that you guys went over that, so that was, I don't know if Heidi has more to
I
add on
have
that.
more dated information than anything because as that became a federal project, it involved different entities. We handed over a whole bunch of information that we had and we're monitoring for the Mohawk tanneries. I would have to get myself up to date with what the current status is in order to speak on in an educated manner on that.
Okay, thank you.
But I'd be happy to look into it some more.
Those of us that are ignorant and in the dark, could you maybe give us a history
Yes, a
What's
little
going on?
bit about her tannery, well, opened in 1924, closed in 1984, and it was contaminant, and it's like 9 contaminants, and so it wasn't usable. So right now, they want to redevelop that land.
Where is the land, if I could ask?
It's off of Exit 6, where the Veterans Parkway.
Okay, yeah.
Yeah,
I know.
kind of adjacent to Little Florida and that whole area. It's
Right.
like 35 acres, 30 to 35 acres,
Mhm.
that is probably going to be redeveloped shortly.
Okay.
And so I want to know how much that the health department, how much information that the Department of Health need to be involved in that. And I think they should because of the contaminants that was there. So
Sure.
I think it's important that,
Okay.
that the city get involved in what contaminants that's still there. And we did have a whole, what you want to call, display of all the contaminants that was there yesterday. And I wasn't quite comfortable with developing that land with the contaminants, even though they did say they was going to do all these things with the land and getting rid of the contaminants. I'm not sure how involved the health department should be with it.
It's-
Because the contaminants are cancer causing.
Yeah, it's not a federal waste site, so is it, or if it is, then the government comes in.
Well, the
Does-
EPA is involved. And
Yes.
It is a waste.
It is?
involved,
Okay, so
yes.
they're gonna have their own standards of
Mhm.
coming in, taking care of it, testing it, because I have a friend who actually is he's not up here, he's down in Atlanta, but that's what he used to do, go and he'd oversight, make sure that it was done, and then they can move forward. So, once the federal government's in there, I'm not sure how much, impact we can have, but we certainly should be actively involved.
Yeah, I believe so.
Okay. Good. Any other questions? Okay. I am now looking for adjournment, if that's okay with everybody. Those in favor?
So moved.
We are adjourned. Thank you. I'd just like to say Happy New Year to everybody.
Happy and
Hopefully
healthy.
Everybody had great holidays.
Thanks.
And wish this year to be the best yet.
You too.